Dr. Susan Little.
And this is Dr. Jolle Kirpensteijn.
And I'm amazed that I came in on cue because I usually miss my cue.
Yeah, she does. And once again, we're experimenting with a new podcast.
Yeah, so this is kind of fun for us. We've started doing a podcast that hopefully you as a cat owner are listening to, because we want to do some educational podcasts that cat owners can listen to and learn some things about current topics in feline medicine, feline health.
And there's only 2 rules.
Yeah, 2 rules. One rule is we don't like to say the DOG word because it's a cat podcast. Yep. So, what's the other rule?
The other rule is that any difficult word needs to be explained. Uh-huh. So we tend, as veterinarians, to use a lot of difficult words. And so I am the difficult word tracker. And as soon as you say one, I'll stop you. I'll give you a little time out. And then I say, what does that mean?
Yeah. So
we have a special guest.
We do have a special guest, yeah. So we are very lucky that we have a veterinary cardiologist, so a heart specialist with us, and that's Dr. Phil Fox. So tell us where you practice, Dr. Fox.
Sure. I practice at the Animal Medical Center, which is in Midtown, Upper East Side of New York City.
Mm-hmm. And it's been there a long time.
It's been there. The origins were 1903 or so, 1910. And it was created by forward-thinking women who looked for ways to help, in those days, were beasts of burdens, which were horses. And from that successful entry, they developed health care. It was mostly for free for companion animals. In the 30s, it developed into actually a clinic. And in the 60s, the Animal Medical Center opened up at its current location, which is Upper East Side of Manhattan.
So it's like 8 or 9 floors of a lot of veterinary specialists, right?
Yeah, there's 350 employees. I might be off plus or minus 25. Wow.
Probably changing every day.
Changing, probably, yeah.
You don't have a very strong New York accent.
Wow. Well, you know why? Because I was in Ohio for 9 years.
Okay, yeah. So this is the Midwest accent.
Neutral Midwest, yeah.
New York accent.
So we have an international crowd here. Susan is from Canada. I'm originally from Holland, and then we have someone from the Midwest. Wonderful, awesome.
Pretty good.
So yeah, we're talking about heart disease,
and
I think as an owner, I'm really scared about heart disease in general.
It's a scary thought, isn't it?
Because, we have friends and family probably that have had heart disease. It's so unexpected. Yeah. And can you tell a little bit about heart disease in cats?
Yeah, and maybe a little bit about, many people are familiar with human heart disease, or they have an idea about coronary artery disease maybe. So
yeah, fair enough. So cats get almost a singularly uniform sort of heart disease. Their heart valves are fine, generally. Mm-hmm. They don't get coronary artery disease like, unfortunately, we do.
And the coronary arteries are the arteries.
Ah, yeah. They're the valve. So the heart has to supply itself with blood. And it does so by blood vessels that come from the left side of the heart, the aorta. And when the heart pumps, oxygenated blood goes out the aorta to all the organs, and some of it goes to these coronary vessels into the heart itself. The heart needs oxygen just like the other organs.
So the heart needs really blood like any other organ in the body.
And it needs it in the right places.
Yes, and that's what these specific arteries do. And they plug up very often in people.
They plug up with plaque, and the plaque can be promoted by unfortunate bad genetics, by many things: smoking, obesity, hypertension, diabetes. All those things make the blood vessels plug up.
And cats do get a lot of these diseases, obesity, diabetes, but they don't get plaque.
They don't get plaque, thankfully for us, it's not a problem.
But they get another disease.
They get another disease. So they get a disease of the heart muscle, and it's called cardiomyopathy. Cardio means heart, myopathy means muscle. It's a heart muscle disease.
Mm-hmm. And they generally get, there are different types of heart muscle disease, right? But they get a kind that we sometimes see in people too.
Yeah, and it's a disease where the left side, there's a right side and a left side. The left side becomes thickened, and the thickening is called hypertrophy. And
so
it's
too much.
Too much. I think it's Greek or Latin, right? Everything is
Greek or Latin, yeah.
And it's called hypertrophic cardiomyopathy, thick heart muscle.
Yeah. So and in the other species, we normally see the opposite, huh?
Yes, and in canines you get a dilated and enlarged ballooning of the left side, and they don't get hypertrophic cardiomyopathy.
Yeah, so the muscle really stretches out instead of really gets too
stretches out, and in so stretching, it can't pump. The cat's heart can pump just fine, but it can't relax. And because it can't, there's two phases. The heart relaxes, and then it fills with blood, and then it contracts, it pumps, and it expels the blood. So if you can't relax adequately, that means the pressure in the heart builds. It's not painful, but the pressure builds. And in some cats, it basically backs up into the lungs, and that's called heart failure.
Yeah, so it's kind of a backflow of blood that really needs to rush through the heart, but it can't because there's not enough space.
Exactly.
Kind of like body. I think of it kind of like bodybuilders. You know those huge, immense people that concentrate just on bodybuilding. These men that get huge, right?
Yeah.
So they have big, strong muscles, but they're not very flexible people, right? So you lose flexibility.
Yeah, women do that too nowadays.
It's very true. Yeah, it's very true.
Yeah.
So just having more muscle is not always a good thing. Not if you're
not always. Yes, exactly. And in fact, it's a bad thing.
Yeah, it's a bad thing. Yeah.
And so, if you have a cat with this thickening of the heart wall or the hypertrophic cardiomyopathy, what are things that you should look for?
Yeah. How would we know a cat has it?
Well, you can't, and that's the problem. You know how cats are; they're silent until there's an issue, that's the problem with diagnosing cat diseases. By the time you detect it, whether it's diabetes or anemia or whatever, it's pretty far advanced. So, this is one of the reasons why it's very important to go to your veterinarian at least once a year, and your veterinarian will check the heart in different ways.
Yep.
And how does the veterinarian do that? So
well, the first thing is the medical history, but they're asymptomatic. So the history is I'm feeling terrific.
Yeah.
The
no
second,
coughing, no lack of exercise.
Nothing. Breathing fine.
Yeah.
The second is physical examination, and the part of the examination that relates to the heart and lungs is using a stethoscope. So that's called auscultating.
Yeah.
And so you listen on both sides of the chest for all the lung lobes. Usually they're fine. And then you listen over the heart valve regions. And cats with cardiomyopathy sometimes have irregular heartbeats. That's called an arrhythmia. And then you can follow that up with an ECG, an electrocardiogram. Or they may have extra sounds called gallop heart sounds. You can hear that with a stethoscope, and you would follow that up with a test called an echocardiogram.
A type of ultrasound of the heart, right?
And using a stethoscope looks always very intelligent, but it is very useful because we do it all the time. And so as students, as veterinary students or as veterinarians, we're always taught to listen to the heart, to listen to the lungs, to listen to the abdomen. But the heart specifically, there are so many things that you can really hear when you use this. It's kind of a machine that kind of strengthens the sound that you get.
Yeah, it's absolutely true. It's a little more challenging with the cat heart because human heart rate is 70, 72 beats per minute. Depending on what kind of breed dog you are, a small breed might be 120, and a large breed might be less. But a cat in a veterinary office could be 220.
Yes.
They're nervous, and when you're nervous, your heart rate goes up.
And so it's a challenge. But veterinarians know how to be patient, and with a little bit of TLC, the cats feel more comfortable. Then the heart rates drop to their normal rate, and if they're 160, 170 beats per minute, you can hear them pretty well.
Yeah, exactly. So, just for everybody to know, 220 is not normal. It's because the cat is stressed, and that's why the heart rate goes up very fast.
Yeah.
So.
Are there any blood tests for heart disease?
Yeah, there are. They're called biomarkers. And a biomarker is any test that involves tissue or fluid from any organ that can be analyzed, and the analysis show a parameter that usually is numerical, meaning it starts at 0 and goes up to some number. And generally, the higher the number is, the more likely there's something affected by an organ system.
Mm-hmm.
Yeah.
So there are some that we're starting to use in feline medicine.
Yes, there's in fact there's a commercial test. It's the test is called BNP. BNP. B is in boy, N is in Nancy, P is in Paul, and you can ask your veterinarian what he or she thinks about it. But it can be useful.
It doesn't diagnose a disease, right? But it might just tell us if we need to look deeper.
Exactly,
Right.
gives you a heads up. If it's positive, then you would feel better about going to an echocardiogram. An echocardiogram is ultrasound, uses sound waves, just like for pregnancy examination, but instead of the abdomen, it's used in the chest.
Yeah.
And you can see the heart, you see it move. And
you see
can
the
measure how big the wall is.
You see all four chambers. You see all four valves. You can see blood flow, the direction, the quantity, the blood vessels. It's extraordinarily accurate and painless and 100% safe.
You do have to shave a little bit.
Sometimes, not always.
Sometimes, not always. In New York, we don't shave at all because
Oh, really?
New Yorkers they don't want to take a dog or a cat home with half the chest shaved. So, and the truth is that we spray a little area with alcohol and use a coupling gel. And we just wipe it off, and it goes quite well.
Pretty good.
And you mentioned electrocardiogram, which is most of the step that people do before they do really an ultrasound. A lot of people are familiar with what an EKG is, but can you explain? It has to do with electric currents, eh?
Exactly. It was discovered in the 1850s, I think, by a German or it was Dutch, Eindhoven.
He was Dutch.
He was Dutch. Yeah, there you go.
Wow.
And
I gave you a shot for open goal.
Yeah,
So
and it shows they're very common in physical examinations. And there's a little patch that attaches to the skin in a wire, and there's several of them, and it measures the electrical current safely and painlessly from the heart. And it transcribes the current on a piece of paper into squiggles, and one looks at these squiggles that are positive and negative in all different ways, and from that you get a sense of heart size, and it's the only test of choice if you have an irregularity of heartbeat.
And I think it's amazing that you can see all those things from a squirrel.
Oh, it's unbelievable, yeah.
We can talk about this for hours. And
It's
we're
amazing,
not going to do it,
yeah.
but I mean, I think that's an amazing thing.
It is.
So what other tests can you do on the heart?
So you start with a stethoscope,
and
then if there's an irregularity in heartbeat, you do an electrocardiogram, an ECG. Somehow it's often also called an EKG. ECG, EKG, the same thing. You can go to an echocardiogram, which is the ultrasound test we just discussed. And if the patient has coughing or breathing problems, you definitely want to take a chest x-ray. The x-ray looks at the lungs as well as the outside of the heart. It looks at the lungs, the airways, the blood vessels. The echocardiogram doesn't look at the lungs as well. It's mostly confined to the heart.
Yeah. So we might see on an X-ray, we might be looking for things like an increased size of the heart, or maybe we see fluid where there shouldn't be fluid.
Exactly.
Right?
Or a mass or a nodule or pneumonia or something like that.
And you can also measure blood pressure in a cat.
Oh, you can, absolutely. It's a little bit of a challenge, but
it's doable.
It's doable, and there's a little tiny cuff like in your arm, but it's tiny, and we usually do it with a cat, and kind of you shut the lights off or you turn it down. You wait a little bit, and they tolerate it mostly okay, and their heart rates come down to 160, 150, and you can get pretty accurate readings. It's totally painless.
And they do get high blood pressure.
They do.
We can treat it.
Yeah, especially older cats. So it's for another reason to go to your veterinarian with a cat, particularly when they get a little older, but not just when they're older. Heart disease in a cat is a disease of young cats.
Yeah.
So if you wait till 10 years of age, you'll have missed that window.
That's a really good point. And we talked in the other podcast a little bit how often you should go to your veterinarian with a cat with heart disease, and you said between 6 and 12 months if there's no clinical signs.
Yeah.
So if a cat is diagnosed with heart disease, what do we do?
Well, you do what's called risk assessment. You look at the heart chambers that you do safely and non-invasively with the ultrasound, and you measure them. And if they measure, lots of normal cats have heart murmurs, and so the ultrasound, more often than not, says it's fine. You find the source of a murmur, it's not important, and you just say this is typical for cats, no big deal. In the event you find a thickening or a dilation of a heart chamber or a leaky valve, then you make a judgment as to is it mild, moderate, or advanced. And you do nothing if it's mild and probably nothing if it's moderate. If it's advanced, then you consider whether one or a couple of medications may have a benefit. And sometimes there's blood tests. If it's an older cat, you want to measure the thyroid level. You want to measure the kidneys. You want to make sure that the pet's not anemic. So, and a lot of these things are treatable if you find it. So if you don't have your pet examined, you won't find any of these things until it's almost too late. And early diagnosis, like with human medicine, is the way to go.
I think that's really important too for high blood pressure in cats. It's rather the way it is in people. It's a bit of a silent killer, isn't it? There's not a lot of obvious symptoms until it's really bad. So with a simple test, we can detect it early and prevent a cat from losing their eyesight. That can happen. Getting serious kidney problems. So that's very rewarding to me as a cat vet. To detect that before a bad thing has happened. Because we have good drugs to treat it.
And can you tell us a little bit about this special relationship between the kidney and the heart?
Well, it's a complex relationship. It's like a marriage.
It's complicated.
Yes, it is like
it's complicated.
But the kidneys love blood, and the heart pumps blood, and all the blood gets pumped into the kidneys, and the kidneys filter out impurities and concentrate the urine and conserve water and all these things that are necessary for life, and that's all fine. But when you have heart failure, and if you're an older cat, you need drugs to make them urinate more. In other words, get rid of extra fluid.
Right.
Well, that means that the kidneys get less blood pumped to them because there's less blood in the system. So it's a real struggle and a trade-off to try to balance it. But it's doable. We do it all the time. But that's an inevitable. It's inevitable that you have to make some decisions. And generally, you can thread the needle.
So kidney disease will put more stress on the heart, and heart disease will put more stress on the kidney. So it's kind of a vicious circle that you're in. Eh?
So high blood pressure, which is associated mostly with kidney disease in cats, makes it harder for the heart to pump blood into it because the pressure against the beating heart is higher. So the heart responds by becoming thicker. And that's not necessarily good for the heart.
No.
Yep. Yeah, and you might think, well, if it has high blood pressure and maybe more blood is going to the kidneys or the pressure is higher, that's good. But kidneys also don't like higher pressure either. They like to be kind of right in the comfort zone.
Yeah,
they don't like it too low, not too high. They like this little comfort zone.
And
and
that's even one more reason to have your pet seen routinely every year or more frequently, because a simple blood test and even a urinalysis is extraordinarily important. That could lead to a blood pressure if you needed to. And early detection is very treatable.
Yep, that's why we
a lot of things you can prevent if you're early. That's really what you're saying. And I think it's amazing to look at the body because everything is connected. We often try to put things in little boxes. So we talk about kidney disease alone, but the kidneys have an effect on everything, just like the heart.
Exactly.
I mean, we cannot live without a heart because it is connected with everything. So if something goes wrong with the central motor, obviously lots of things start failing if you don't do something about it.
And that's often why as cats get older too, vets will recommend that they see a veterinarian sometimes not just once a year, but maybe twice a year, because things change more quickly, more prone to developing diseases, and we want to find them early.
Yeah, once a year is not enough for cats that have mild changes in blood test results or something.
Yeah,
I always compare with the car. So you can wait until your car breaks down, and then it's really, really expensive to fix. Or you can change the oil in advance, and probably the car will do a lot longer.
Do maintenance.
Yes, exactly. That's
Change
exactly.
your tires.
This has been very informative. Thank you so much.
Yeah,
this
pleasure.
is wonderful. Thanks, Phil. This
Lovely
is
to have
amazing.
a nice chat about feline cardiology.
I know.
Thank you.
Thank you.
Cool. Well, that was painless.
Dr. Susan Little is a feline medicine specialist with 2 cat-only hospitals in Ottawa, Canada. She is best known as an international speaker and as the author and editor of 2 textbooks, The Cat, Clinical Medicine and Management, and August's Consultations in Feline Internal Medicine. Along with 3 cats, she also admits to owning 2 dogs, and you can follow her on social media with the handle @CatVetSusan. Dr. Jolle Kirpenstein is a diplomate of the American and European College of Veterinary Surgeons and a big cat fan. His specialties range from surgical oncology and reconstruction to minimally invasive surgery. He is the author of 2 textbooks on basic and reconstructive surgery. Did you know he was allergic to cats? Jolle works currently at Hill's Pet Nutrition. You can follow him on social media with the handle @GVETSX. The opinions of this podcast are those by Dr. Susan Little and Dr. Jolle Kirpenstein. Veterinary medicine is a complex profession, and often there are multiple diagnostic and therapeutic options for different disease processes. If you're a pet owner with questions, please go to your local veterinarian.
Both Dr. Susan and I sincerely thank Jake Adams for composing and performing the music.